This video will cover the anatomy and physiology of the breast. The breast is present in both females and males. The boundaries are from the 2nd to the 6th rib, the sternum medially, and the axilla laterally. It is supported by the pectoral muscles, serratus anterior muscles, and Cooper's ligaments. Externally, the areola is the darkened area around the nipple, containing Montgomery glands that produce sebum for lubrication and protection. The nipple is porous, with terminal ends of milk ducts that deliver milk. Both the areola and nipple have erectile smooth muscles. The breast shape is predominantly circular, with a minor oblong part extending into the axillary region, known as the axillary tail. It is conventionally divided into 4 quadrants. Internally, the breast is composed of parenchyma, which includes glandular tissue with ducts, making up 2/3 of the tissue under the areola and nipple. The supporting stroma includes adipose tissue, Cooper's ligaments, blood vessels, lymphatics, and nerves. The blood supply comes from the lateral thoracic, axillary, and internal and intercostal arteries, providing oxygen, nutrients, and hormones while removing waste. Lymphatic drainage includes peristernal and axillary nodes, important for fluid return, and the immune system. Neuronal pathways involve the intercostal nerves, which communicate with the central nervous system. They provide sensory input, like tingling or pain, and motor control to the nipples and areola. Notably, motor nerves are not found innervating the alveoli. Conventionally, the glandular tissue consists of 15 to 20 lobes, which contain lobules, alveoli, and lactocytes. The alveoli are the milk-producing structures, connected to a system of ducts. In the conventional view, milk flows from the alveoli through small ducts, into larger ducts, then into milk ducts, or lactiferous sinuses, and finally out through the nipple. New imaging techniques have updated our understanding. They suggest fewer milk ducts, with an average of 9, and that they branch closer to the nipple. The ducts beneath the areola are superficial and do not store large amounts of milk, only dilating with the milk ejection reflex. Alveoli are the basic units of the mature mammary gland, where breast milk is produced, stored, and released. They are lined with lactocytes, which secrete milk, and surrounded by myoepithelial cells responsible for squeezing milk into the ducts. Milk ducts carry milk to the nipple. They do not actively participate in milk secretion or modification. They have an inner layer of epithelium and an outer layer of contractile myoepithelial cells, and their shape varies with the amount of milk present. The lactocyte, or mammary secretory cell, has junctions between cells that are tight during lactation and leaky in non-lactating and pregnant breasts. The apical side is where secretion occurs, and the basal side is where materials are taken up from the blood. Lactocytes use several secretory mechanisms: exocytosis for most proteins, lactose and citrate, transcytosis for immunoglobulins, droplet secretion for fat, diffusion/osmosis for water and ions, and paracellular transport between cells for white blood cells and water-soluble compounds. Major constituents of milk include proteins, such as immunoglobulins, milk proteins, hormones, growth factors, and enzymes. These are either transported from circulation or synthesized within the lactocyte from amino acids. Carbohydrates are another major constituent, with lactose making up 98% of carbohydrates in breast milk. Glucose and galactose are transported into the lactocyte, where lactose is synthesized. Fat provides 1/3 of the breast milk calories and essential fatty acids. Short fatty acids are made in the lactocyte, while long fatty acids are imported from the blood. Fat is secreted in droplets with lipases to aid digestion. Other constituents include metabolites and ions like citrate, sodium, potassium, and calcium, as well as living cells such as white blood cells and stem cells. The human mammary system changes dramatically from birth through puberty, pregnancy, and lactation. Fetal development starts with the primitive milk streak and progresses through the formation of epithelial buds, ducts, and the external nipple and areola. In the prepubertal stage, a rudimentary ductal system develops proportionally with the rest of the body. During puberty, estrogen drives breast growth, primarily of adipose tissue, leading to an extensive ductal network and epithelial proliferation until around 35 years old. During pregnancy, external changes include breast enlargement, thinner skin with prominent veins, and increased areola diameter and pigmentation. Mammogenesis in the first half involves rapid ductal branching and lobular formation, influenced by various hormones. Lactogenesis 1, starting in the second half of pregnancy, involves the differentiation of epithelial cells into lactocytes and the synthesis of milk-specific components. This early milk secretion is known as colostrum, influenced by a mix of hormones. After delivery, the dramatic fall in estrogen and progesterone triggers lactogenesis 2, the onset of copious milk production. Prolactin synthesis of lactose draws water into the secretion, contributing to increased milk volume and the closure of tight junctions. Lactogenesis 3, or galactopoiesis, is the established lactation phase, regulated by milk removal and hormone release. Involution, the cessation of lactation, involves the reopening of junctions and the apoptosis of lactocytes, potentially triggered by pressure or feedback inhibitor of lactation. Prolactin, stimulated by suckling, is secreted by the anterior pituitary and stimulates lactocytes to secrete milk or fill up. Oxytocin, secreted by the posterior pituitary, causes the myoepithelial muscles to contract, squeezing milk into the ducts in what is known as the letdown reflex. This diagram summarizes the hormonal pathways involved in lactation. Suckling stimulates both prolactin and oxytocin release, which act on the lactocytes and myoepithelial cells, respectively. Dopamine and full glands can inhibit prolactin. The lactation cycle, shown here in the alveoli, progresses through phases including resting, recruitment, filling, full, milk removal, emptying, and involution. A normal breast varies in size, shape, color, and placement among women. Asymmetry is common, and supernumerary nipple tissue can occur along the milk line from the armpit to the groin. The size of the breast does not matter in terms of function. Flat nipples are also considered within the range of normal breast anatomy. Anomalies of anatomy and physiology include mammary hypoplasia, which is insufficient breast development, and conditions like retained placenta or damage to the anterior pituitary. Other factors that can affect breast physiology include hormone disorders, anemia, breast cancer, and breast surgery, such as reduction, augmentation, lift, or abscess drainage. This video's content is based on the references listed here for further reading.